Hey everyone, it's Presley at ActOutGames.com here, and today we're doing Presley's perspective on, I don't know.
Right. So
the only thing I know is going on is in Harry Potter.
That's right. Presley's very familiar with what's happening in Harry Potter now that she's getting closer to halfway through the third book.
Yes.
But thought we haven't done a Presley's perspective in a little while, and as part of our homeschooling and kind of showing you guys how we do some of our homeschooling even. That it was time to do another Presley's perspective. If you're keeping up with the news at all, you know that the current events that's going on right now are all around the financing the government, the potential shutdown of the government, all sort of based around Obamacare and the healthcare debate and all of these things that are going on in general. That's an awful lot to talk about.
The only thing I know that you're talking about is Obamacare. I don't know. I heard you talking about it. It's apparently a thing for people who don't have insurance.
Me and Mommy were talking about in the car, right?
Mm-hmm.
Yeah, okay. So I think that's probably what we'll talk about. We'll talk a little bit about Obamacare, but mostly we'll just kind of talk about healthcare in general and how healthcare and insurance works in the country and maybe in some other places and stuff. So why don't you tell me what you know about Obamacare?
It's a thing that helps you pay for insurance if you don't have it.
Mm-hmm.
That's basically all you said, or I heard you said. I may have fallen asleep.
Well, a big piece of it, and the piece that people I think have the biggest problem with, is that it requires everyone to have health insurance. So
everyone?
Yeah, everyone has to have health insurance or they have to pay a fine. Do you know how health insurance works? Or how insurance works in general, like car insurance?
They pay for what you break. They pay for your cars that you break. They pay for your motorcycles you break.
That's right.
They pay. I don't know what they would pay for in this life insurance. What do they pay for?
Well, life insurance pays if you die.
It pays.
They pay whoever you say they should pay. Yeah, your beneficiary.
They pay someone
that's
if
called.
you die.
Mm-hmm. So how do you think they afford to pay for your car when it breaks?
Because people buy it.
People buy what?
The insurance.
Right.
And they get money from that. And they also must have other people doing other jobs for them.
Mm-hmm. No, that's pretty close. So what happens with insurance, like the idea behind insurance, is that a lot of people get together and they pool all their money together, right? So it's like if we and all of our friends and all of our family, we all decided that we were going to pitch in $100 and we're going to put $100 or $1,000 or whatever in the bank. And if someone, has a car crash or gets sick or something happens, they can use that money to pay for fixing their car, right? And since not all of us are going to have car crashes, some of us will put in $100 and we'll never use it because we'll never have a car crash, right? Mm-hmm. And some people will have like 5 car crashes and they'll use a lot of the money. And some people will have 1 car crash and they'll get to use it. But the idea is that you don't know who's going to have a car crash. So everybody ahead of time puts all this money away so that whoever happens to have a car crash has some money that they can use, right? And so everybody pays in and then they share that money. And that way, everybody is sharing the cost of fixing the cars that get broken, right? So the more people that agree to pitch in, the less each person has to pay, right? So if you've got like a $5,000 car bill and only 5 people are helping pay for that, then it's $1,000 a person, right? But if 1,000 people are helping pay for it, it's only $5 a person, right? So that's kind of how insurance works in general. So the same thing happens with health insurance, right? You have health insurance and it pays when you have to go to the doctor. And the same thing happens. A bunch of people get together, they pool all
the... Did they just pay for me going to the doctor to get my blood drawn?
Yeah, they did. Our insurance paid for that. Right? And so what happens is we put money in and other people put money in and lots of people pitch in, and then whoever has to go to the doctor, they use that money to pay for going to the doctor. And the assumption is that it costs us less to buy insurance. Mm-hmm. Like, you don't put $50,000 in and then you only get to take out $100 to go to the doctor. Mm-hmm. If it worked that way, then you would just save your money and pay the $100 to go to the doctor. Right? Mm-hmm. And so, in general, what Obamacare is trying to do is get more people pitching into the insurance so that it's cheaper for each person, right? Because the more people that pay in, the less it costs per person, right? But what people are really upset about is that, it's the government. Again, we get back to this. We talk about the government a lot. it's the government forcing people to buy insurance, even if they don't want insurance, right? But what ends up happening a lot of the time is that, when we had to take you to the emergency room, like when you bonked your head and stuff, when you dislocated your elbow, when you had your concussions or nursemaid's elbow, you go to the emergency room and you'll see people that are in the emergency room with like the flu or like a cold or something, right?
That's kind of stupid to see that. They have a cold. You don't have to go to the emergency room for a cold.
A lot of this is people that don't have insurance, right? And one of the things that happens at the emergency room is they have to treat you, whether you have insurance or not, right? So the emergency room treats these people. They can't afford to pay for it. And so we end up paying more in our insurance to cover those kinds of things, right? Or in taxes if the government's paying for it. So everybody, we really kind of pay for it anyway, right? So really what they're trying to do is make it to where more people are pitching in and paying into the pool so that it's less per person to do that. And then also everyone has insurance. So, you don't have people that can't afford insurance or can't get insurance. There's also a lot of rules in there. Like right now, it's kind of hard for someone to get insurance if they're not getting it through their job. Right? Like I get it through work and your insurance comes off of my insurance from work. And so it's pretty easy to get it when you're getting it through your employer. But if you work for yourself or your job doesn't give you insurance and things like that, it can be really hard and really expensive to get insurance. And so they're trying to make it cheaper to get insurance, which I think, like all of these, I think are a good thing, right? There's this totally separate question with Obamacare about whether it's okay for the government to force people to do that, right? Like overall, I think it's a good idea for there to be more people in the insurance pool and to be distributing the cost among more people.
It's good to put stuff in the pool, but it's not good to force people to put stuff in the pool.
Right. You don't think it's good for the government to force people to do it?
Why would you do that? Mm-hmm. Insurance is about a bunch of nice people putting money into this pool to pay for other people's not deaths. Like when they get sick, when they die, when their motorcycle gets broken. It's a bunch of nice people who do that. If you're forced, then that's not like normal insurance, which is a bunch of nice people who decided to put money into this one big pool of money.
That's right.
Which actually makes me think like they're putting money into construction of our pool, but
they could, right? So it's kind of the same thing. Like if all of our neighbors got together and we decided, hey, we're all going to pitch in a little bit of money and we're going to put a pool in somebody's backyard, and then everybody can share it and use it, right? So you share the cost. And you're absolutely right that historically has been voluntary. Like people just decide that they want to contribute. They think it sounds like a good idea. It helps save them some money. And in case something catastrophic happens, because it can be really expensive to have these kinds of things, that they voluntarily join in and they do it, right? And so it's really weird that the government's forcing people to do it.
Yeah, right? That basically takes everything happy out of insurance. The only thing
not a lot of happy stuff in insurance.
The only thing happy about it is that that there's always a bunch of nice people who are paying for your.
That's right.
For what's
but it also, there are, like, we're lucky because we're in a good situation. We have good insurance. We don't have to worry too much about those kinds of things. But there are people that really struggle to find insurance, and I think it is kind of wrong that it's hard for some people to get insurance, to qualify, or to. And then, so there's this thing about like pre-existing conditions, right? So a lot of times if you're sick already, it's really hard to get insurance because insurance knows that you're going to spend that money. And so they don't want you to be part of their policy.
Why?
Because it's a lot
because it's mean people.
Well, with insurance, like most insurance companies, it's about making money, right? They make money. The insurance company assumes that people like pay in all of this money to the insurance. And the people who take it out, when all the people take out the money they need, at the end of the day, they have money left over that they get to keep, right? So the insurance companies are in it for a profit. So that goes into a whole different thing. So I don't disagree with your idea on the government shouldn't force people to do it, right? Even though, and this is a weird thing, you run into these sometimes, and there's a lot of these that I have. I think that did you just poot on your vlog? Can you maybe not do that? That may be your first vlog, Onada. I kind of lost my train of thought there a little bit. I think that there are lots of things where, like, I think that what's being done in insurance is a good thing, right? I think it's a good thing that more people are participating and that it costs less per person and that people who don't have insurance now will have insurance and be able to get insurance, and everybody will be able to get the care that they need to do what they need to do. I think all of that is good. So I think that what Obamacare is doing is good, but
it's not good to force people.
It's not good to force people to do it, right? I think that, I think the ends don't justify the means is what you would say to that, right? That it means that just because you're doing a good thing doesn't mean you can do a bad thing to do that good thing, right? But then one of the other things, this is something that we were talking about in the car too. I don't know if you ever heard this or not, and this is kind of a side piece of this conversation, but healthcare here is very expensive relative to other places. So other places who have, like, it's required, everybody pitches into insurance basically, right? It's called socialized medicine, where it even goes beyond everybody having to have insurance. It's that the government provides you health care and your taxes just pay for it. You go to the doctor and you don't even have to pay. There's no insurance, there's no nothing, right? So it's cheaper in a lot of those places. But so the free market is, because we're getting into a whole other area here, but the free market means that
market with free stuff?
Well, no, it's kind of the opposite. It means there's no government controlling the market. So if you want to sell something, you can charge however much you want. You can sell it to whoever you want. And like if you're selling computers, right? So you start a company and you're selling computers, then if you can make 1,000 computers a month, then you can charge as much as you want for those computers. But at a certain point, you're going to charge so much that you can't sell the computers. People won't buy the computers anymore, right? And then you kind of scale your price back a little bit, and you can charge as much as you want and still sell your 1,000 computers a month, right? And you sell out and you can't make any more. So there are people who can't afford your computers, but that doesn't really matter because you're selling all the ones you can make, right? And then if somebody else comes along and these people who can't afford your computers, they open a computer company and they start selling their computers for less than you sell them for, then they take all your business and you have to lower your prices. So that's competition. So people can come in, and if you can make money and sell for a lower price, then people will do that. So that's the competitive marketplace, and people think that in a lot of cases that the free market is the best way to price things. That the market will adjust and people will sell it for less if they can sell it for less and still make money, and they'll steal all the business, and that'll get to the lowest price, right? I definitely have concerns about whether healthcare works in that free market model, because like with a computer, you don't really have to have a computer, right? And there's a certain amount of money that I'm willing to pay for a computer, and I won't pay any more for it, right? But if I'm sick and I need an operation or I'm going to die, then I'll pay whatever for that, right? There's not really a cap on how much I'll pay for that. I'll borrow money, I'll sell things, I'll do what I have to do to pay for that. And so, you get to the point where only wealthy people can afford the surgery to stay alive, and poor people can't afford it, so they don't get the surgery and they die, right? But the doctors are busy and they're making all their money because they're selling, they're doing as much as they can, and it's a very complicated process, right? And whether the free market is the right thing for healthcare, I don't know the answer to that. Yes, go ahead.
Why does it cost money to get surgery? I think surgery would probably be a bunch of nice people who decided to dedicate their lives to saving people's lives, not making money.
Right.
It's just a bunch of selfish people. This world has turned into a bunch of selfish people who only do their job for money. I think that people should start thinking about, like, if you're a surgeon, I think you should start thinking about talking to whoever owns the company about lowering the price if it's not very low already.
Yeah. Well, so
Why should it cost like $1,000 to be your life to be saved?
Yeah, a lot of them donate their time to people who can't afford, so they do spend some time there. But the fact is that it costs money to do a surgery, right? There's a hospital that has to pay rent. There's equipment that they use. The doctors go to school for many, many, many years, and you have to pay them because they have to pay their mortgages and buy their kids' toys and drive a car to work. Like, I get paid to do what I do, so that we can
to do with their work.
Well, no, like I get paid at work, and what I do with that money is I buy you toys. We set up a little vlog studio in the basement, right? We spend that money to make our life better, right? And so the doctors have that same thing, right? So it costs money, And even if you don't take into account like what you're paying the doctor, even if the doctor decided to volunteer his time, right? There's all the equipment that you have to use. There's the drugs that they do. I mean, everything costs money, so someone has to pay for it. So, what you're talking about is a little bit like the socialized medicine I was talking about, where over, like in European countries, like I've got friends that live over in these places, and maybe they'll come in. I think they watch your blog, in fact, that they have this socialized medicine, so everybody pays taxes, right? And everybody takes a little bit out of their paycheck and they give it to the government, and then the government provides free health care. If you need to go to the doctor, if you need to have surgery, if you need to do whatever, you go to the doctor and you have it done.
That is a much better thing.
That is or is not?
That is a good thing.
You like that?
Yeah, you give money to the government and they use it to help people with healthcare. That's actually a very, very nice thing.
Yeah. So, I mean, it's interesting. I hadn't really thought about it too much about the difference between the government requiring you to buy insurance on your own versus the government taking taxes and providing free medical services to you. I mean, that may be a totally different legal issue. I mean, it is a totally different legal issue, and I'm not sure what I think about it. I'd have to think more about it, but it's an interesting question. I
think the thing, what you just mentioned is like a perfect thing to start doing with society.
You think?
You pay taxes, which go in free into health care.
Right.
Which go into helping poor people and homeless people pay for health care.
Mm-hmm. So, I mean, it sort of becomes a question of, is healthcare, like being able to be healthy and go see the doctor when you're sick, is it a right? Right? Is it a privilege or is it a right?
It's not a privilege. I think everyone should be able to have health care. Why would you not be able to have health care?
Yeah, no, I
Why
don't
do people
disagree.
make you not able to have health care if you don't have $100 that you need for your health care?
No, that's a good point. That's why I love having these conversations with you. You make me think about things that I haven't, or think about it in a way I haven't thought about it before. Mm-hmm. You're very smart. So, yeah, and there, like I said, there are some of my friends that live in other places. They live in places that have social medicine. And so one of the complaints that people have, and maybe we're running a little long here, so this may be the last thing that we talk about here, but this is one of the complaints that people have, and this is going to make you mad too, because this makes me really mad. So, like, right now, only a certain, like, let's say half the people in the United States have insurance. It's not that, but let's say it's half the people in the United States have insurance, right? So those half of people, like us, are going to the doctor. Like, I've got a doctor's appointment tomorrow. So I called on Friday.
I had one a few days ago.
You had one a few days ago. I called on Friday. I said, hey, I need a doctor's appointment. They said, hey, you come in Monday, right? So it's not hard for me to get in to see the doctor. It doesn't take a long time to do these kinds of things. But if everybody had insurance and everybody was going to the doctor, then the doctor would be a lot busier and it would take me longer to get in to see the doctor.
Hire more people.
Well, yeah, finding more doctors and doing those things is a good idea, but you got to deal with that, right? But so some people actually make the argument that it's better for me if those people don't have insurance because I don't have to wait to go see the doctor.
Oh yeah, I learned. I was playing. I think I was playing Skyrim, and I came up on the news, and that just made me mad.
I figured that would.
I don't know how to say.
That makes me mad too, and a lot of people don't say that out loud. But when people start talking about wait times and things like that, that's really what they're saying. Is that it's better for me that a bunch of people can't go see the doctor because I can get in and see the doctor faster.
No, why do you even worry about? If you are having big trouble, you have an emergency stop in ER, which makes the doctor stop whatever they're doing unless it's another emergency and go pick you up. So the wait doesn't matter if you're not about to die, because if you're about to die, there's an ambulance. I almost forgot what an ambulance was called.
Right.
That goes and picks you up and takes you to the doctor, and any doctor that's not working on a patient that's an emergency is probably going to go work on the person in the ambulance.
Yeah, that's true.
It's unfair that people think the wait matters. And the wait doesn't matter if you're about to die because you're going to be in an ambulance and one of the doctors is going to be stopped to go take care of you. So if you have a cold, you could probably bear. You're not going to die if you just wait an hour for all these people to have their colds treated.
Right. No, I mean I agree. That's one of the most distasteful things about the whole thing to me. But and there's got to be a better way, right? And whether the government should be able to force you to do it, or whether the government should provide the services for your taxes, Again, doctors make a lot of money right now. It's one of the professions where you make a ton of money, and maybe you're right. Maybe it shouldn't be that way. But then you run into, a situation where right now people go to med school and people want to become doctors because they can make a lot of money. So you have doctors because they can make money, right? Whereas if they made a lot less money, you might have less doctors. And if you had more people with insurance and less doctors, the system gets plugged up pretty quickly. I mean, it's a very complicated problem, right? But, you should always, all of these conversations we have, all the Presley's perspectives that we do and everything that we talk about, like the most important thing for me, for you to think about is I always want you to keep your moral compass. You know what that means?
No.
It means,
We had to stop after talking about that. It's been quite a long time.
Thinking about what's right. Like I always want you to be thinking about what's right and how you can accomplish that and how you can get that done, right? That's your moral compass is always, you never deviate from what the right thing to do is just because it's easy or because it's better for you or those kinds of things, right? You always think about what the right thing to do is and focus on that.
The easiest way to think about this is in some games, if people try and speedrun the game, go a quicker route, that's not the actual way to go. They sometimes make a death trap. So that teaches you to not steer your mind off of what's the right way to go. Because I don't know why, say you were playing Skyrim and you were going up a mountain, and there was this path up the mountain. Even though it wouldn't be easy, there was like a dragon. If you went the other way around the mountain, which didn't have a path, which had a path, and instead of climbing the mountain, it was a death trap, which would spawn a dragon.
Right.
Even though it would be faster and easier.
Right.
That teaches you that if you'd rather climb a mountain than have to kill a dragon.
Right. You can learn a lot from video games. It's a pretty convoluted example, but I'm there with you. Yeah. Right. So I think we can, to sum up and wrap up this blog on healthcare and Obamacare, I think we can both agree that we think
Skyrim for some
and
reason.
Skyrim and Harry Potter, in fact.
Yes.
We think it's a good idea that everyone should have access to healthcare. Everybody should be able to go to the doctor when they're sick. Everybody should be able to afford the operations that they need. But there's a lot of disagreement over how you make that happen, and that the focus should be on doing the right thing and getting everybody the health care that they need. And once you decide that that's your goal and that's what you want to accomplish, then you focus on a solution.
Right.
Yeah.
I want to accomplish people to stop arguing about other people. Why?
Right. No, that would be a good thing too.
Yes.
Anything else you want to add?
Anything else I would like to add? Not really.
With this one? Okay. Johnny.
Bye. I'm moving sideways.